the microneedling, or the CIT, which is the collagen induction therapy. So the first thing we'll do is the patient will sit with numbing cream on for about 30 minutes, and then I'll cleanse her skin and take off all the numbing cream.
So is your face pretty numb?
Yes. It's very numb.
Usually, especially around the mouth, after about 5 minutes, they start to feel it pretty quickly. Now, once the skin is clean and dry, the next step is to use a hyaluronic acid serum. That's going to give the skin and the needles lubrication to move, but then it also, the needles will penetrate the hyaluronic acid into the skin. And hyaluronic acid is something that we naturally have in our bodies, and it binds our water molecules together. So it's excellent for hydration. And I always start really light on the skin just so the patient gets comfortable with the needles and the vibration. You can see the device, it has 12 needles at the end, and depending on how high I turn it up is how deep the needles go. And we go in multiple different passes, different directions.
So how does that feel?
You don't really feel anything.
So there's no pain.
No. You feel the vibration, but it doesn't hurt.
Everyone's pain tolerance is different. So, you know, we'll definitely customize that by patient. As you can see with just the third pass, we've definitely got some pinprick bleeding, but no pain, right, Sam? You're okay?
No pain. I'm good.
The patient, we schedule it for an hour and 15 minutes. They come in and sit with the numbing cream on for about 15 minutes. And then we cleanse the skin. And then the microneedling itself takes about a good 45 minutes. I have many patients who actually fall asleep. No one believes this, but it's actually kind of relaxing with the vibration
It's like a
and the
face
motion.
massage.
And you can see under her eyes, I haven't gone super close yet. I've kind of just finished at the orbital bone. Because when I'm done, I'll go a lot lighter and I'll get really close around the eyes to work on kind of the crow's feet and the dark circles. But I like to do that last. So doing the microneedling on the nose is especially beneficial for the pores and for the blackheads, the milia. So the best results for this treatment would be to do a series of 3, spaced about 4 to 6 weeks apart. And then from there, based on how your results are, you can do about like once or twice a year. The forehead's a little more sensitive area. And again, because it's right on the bone, we go a little lighter in this area. And I like to hit the crow's feet and the temples aggressively in the glabella area, and then we'll go lightly around the eyes and then finish at the neck. So now we're doing the neck, and the neck gets wonderful results in the crepiness of the skin and the fine lines and wrinkles. The neck, though, is also more of a sensitive area, so we don't do as many passes on the neck. We'll do 2 to 3 at the most.
Now, can CIT be done on other areas of the body?
Absolutely. You can do it anywhere. Right? On a lot of patients, we'll do it on their décolleté, but you can do it on the hands, any scarring anywhere on the body does really well. Once we've microneedled the skin, then we rinse the face with distilled water before we apply the acid. So I give the patient a fan just to help cool down the skin with the acid. The first layer of acid we normally apply is a 4% hydroquinone, which is amazing for hyperpigmentation, melasma, sunspots. And we'll do 1 pass all over. Patient normally, the burning sensation is as the acid is kind of penetrating into those pores, into those holes into the skin, but it subsides very quickly. Once the skin is cooled down, which is about a minute or two later, we apply a 0.5 retinoic acid, which is basically a really strong retin-A, and this is what causes the skin to peel. It's excellent at stimulating the collagen and elastin, which helps with fine lines and wrinkles. The patient will leave with all of the acid still on their face, and we recommend not putting any moisturizer or sunscreen on for an hour, and after that to still wait to wash your face for 4 hours. And then post-care would be similar to any other peel in the fact that you want to use a gentle cleanser, moisturizer, and sunscreen. No harsh products or scrubbing or exfoliating for a week.